Hi everyone, this is Dr. Manning. I wanted to jump on and give a brief video about some of the questions you may have around coronavirus or COVID-19. A lot of patients have questions, and I thought it'd be good to do a summary. A lot of information out there, some good, some bad. I find that a good summary of the key points is helpful, and I hope this will be helpful for you. I've just done a blog post outlining these details, and I've outlined it in using the COVID acronym, COVID. And the first thing to remember about this virus is that it is contagious. About every one person infected will possibly infect about 2 to 3 other people. So the best way to reduce contagiousness is wash your hands. Soap and water, 20 seconds at least. Very important to wash before you prepare foods, use the bathroom. If you cough or sneeze, use a tissue, wash your hands. Do not touch your face, particularly your eyes, your mouth, your nose. Those are just places for viruses to enter. Sneeze or cough in your elbow. Also, if you utilize tissue to sneeze or cough into, make sure you throw it away. Make sure you wash your hands after you use those things. Important things: no handshaking, no hugging. Again, it may feel awkward, weird, but it's important. The majority of germs you pass are on your hands. The O is for okay. It's going to be okay. Don't panic. This is a virus. We've dealt with many viruses before. I think the thing that causes confusion about this is that there's so many intricacies of this virus that we don't know yet. We know the flu. We see it every year. We understand it. When you don't know something, you tend to fear it, and fear has developed over this condition. We don't need to fear it. We just need to understand it. And it's amazing to me as a physician that the data coming out of China and other places as this develops is incredible. We're learning so much about this condition and disease, and we're changing rapidly how we approach, how we prevent it, and how we address it. So that's really cool to see to me. And talk about some of the things we're not doing well. There are a lot of things we're doing well, I think. But when we talk about this virus, we need to remember who's most vulnerable, who are the high-risk patients for serious illness and death. Those are folks who are individuals over 60 years old, and those who have underlying medical conditions like heart disease, lung problems, especially like COPD, asthma, but even other conditions like diabetes, and those who have immune systems that are suppressed, either from conditions or from treatments, like cancer treatments. Those are very vulnerable people. The vast majority of patients have flu-like illness, fever, body aches, cough, and shortness of breath, with a focus on lung symptoms. Thankfully, so far, children are largely spared from serious illness, and the majority of people still recover from this. But again, the elderly and patients who have underlying conditions are highest risk. The V, be vigilant to protect those around you. You may be young and healthy, but the most concern is to those around you that are older and possibly vulnerable. It's difficult to reduce some of the outings and community events, but this has been shown to drastically reduce the contagiousness and mortality in endemics and epidemics like this. So very important. It may seem like overkill that colleges are canceling classes and sporting events are canceled, but it is a very key step in reducing the contagiousness and spread of this condition and reducing the strain on medical resources. So we'll be better apt to take care of those who really need hospitalization and all the resources we can provide. The I is infection. So what symptoms should you expect if you do get infected? Fever greater than 100.4, is defined as a fever, typically a dry or productive cough, and eventually shortness of breath. If you have those symptoms and you have been in close contact with anyone known to have COVID-19 or live or travel to an area that is endemic with ongoing spread of COVID-19, you need to contact your doctor's office or the emergency room for further details. They can direct you on what to do next. There are a few key differences between COVID-19 and other viruses like the flu. Typically, flu has an abrupt onset. Fever, body aches, cough occur pretty rapidly, quickly. Whereas COVID-19 appears to be more gradual, with fever and cough, and then eventually shortness of breath, which can occur over a few days. From what I've seen, is about 5 days, period, 14 days. But it looks like it's more around that 5 to 9 day period where you begin to show symptoms. The next thing is D. So we're doing our COVID, COVID. D is diagnosis. How is infection identified, and what can we do about it? How do we treat it? So right now, the problem is kind of twofold. One, we don't have tests available in our area. Some places are getting it. Our local health department is probably first to get the tests to diagnose COVID-19. But we also don't have a very good clinically significant test, meaning it's not rapid and it's not simple. So we can't tell you on the spot whether you have this. And even if we did, there's no clear treatment for this. So right now the focus is on supportive measures. The recommendation is if you're overall healthy, then if you are exposed or you have symptoms, become infected, then quarantine is the most important step, and typically quarantine at home. So here's our plan for our office going forward, and this is based on the CDC recommendations and guidelines. And this is if the infection becomes more widespread in our area. Here's what we plan to do. Identify patients who may have COVID-19 and treat them outside the clinic. While we want patients who are sick to get help, we don't want to expose high-risk people to this virus. So we ask that if you have fever or flu-like symptoms, that we ask that you not come to the office. Again, if this becomes widespread, we're going to ask you not come to the office. Instead, contact us by phone, email, or text. This is the benefit of direct primary care and being a patient in our office. You can contact us through these modes, and we can give you some direction on what to do next. Be patient. We're probably going to be very busy with other patients as well, so we appreciate your patience. Please let us know your symptoms, and we'll give you guidance what to do next. This could even include triage and evaluation in our parking lot. Remember, we can't test at this time. That may change in the future, but we can't. There's no adequate treatment for this, or no specific treatment, I should say. So it makes things difficult, but right now that's the situation we're in. Thankfully, most people recover just fine. They need rest, they need hydration, and time to deal with this. Also understand that we may have high-risk people who need to get to the office. So infected individuals in our office could spread that infection to others, and we don't want that. So again, we ask that you call us first. We can give you the proper direction. If we become concerned that this area has become infected and more widespread, again, those high-risk patients we don't want to be exposed. Age over 60, those who are diabetic, poorly controlled, those who have significant lung problems like COPD, asthma, heart problems, and those immunosuppressed or on medications that could cause that. Also, do not go to the emergency room if for routine symptoms. This is going to inundate the emergency room, and they need to be available for patients who are sick and who really need that service. So why should you go to the ER? If you have persistent shortness of breath or chest pain, then you need to go to the emergency room. Again, as you call us and we get your symptoms, we'll be able to assess and give you good direction on whether that's the appropriate step or what the next step for you is. And then also, if you're unable to hold down fluids and are becoming possibly dehydrated, a good reason to go to the emergency room. Stay up to date. Check the CDC website, coronavirus.gov, very helpful resource, and we'll update our blog as we get more information about this. Stay healthy, get good information and good direction on this, and again, things are evolving on a daily basis, so stay up to date as best you can. Thank you very much. If you have any questions, feel free to give us a call.